recording, but can somebody give us a thumbs up or put in the chat that we've got, you got it? Okay, so Becky's recording.
Okay.
Okay, then we're good to go, Kelly.
Good? Okay, great. Thank you for that. So just a reminder to the moderators who are moderating or fielding the questions from the Zoom chat and from Twitter, make sure you have that room for moderator communication document open that was in that Google Drive. That way we'll refer to that at the end. So we'll go ahead and get started. Dr. Eason, do you mind advancing the slide?
I would if it was working. I'm not sure why it's not. There we go.
There you go. All right, so these are our program leaderships for the evening. We have a total of 6 programs here. And these are our moderators from each of the, oh, I think you went back. Do you mind advancing forward, Dr. Eason? Thank you. Oh. Technical difficulties. There we go. Thank you. So these are our moderators for the evening who will help answer some of these questions for us. And so what I'll do is I want to make sure everyone has a chance to get equal time to talk about their program. So I'll set a timer on my phone. So everyone should have about 4 to 5 minutes to talk about their program, and then we'll have time at the end for the Q&A. So please don't be offended if I cut you off. I just want to make sure that every program gets a chance to talk. All right, so Dr. Eason, do you mind advancing? Thank you. All right, Dr. Eason, looks like you're first.
I am first. The advancer of the slides goes first. So let me just quickly tell you about our program here at Loma Linda. We are a large academic program with 100 residents, 84 peds and 16 med peds. And the unique problem, probably the most unique aspect of the program is how small that it feels for this size. And there's a couple reasons for that, and that's the next 2 bullets. We have fewer fellowships than most programs of this size, although every single subspecialty is represented, and we have multiple specialists in each subspecialty. We don't have a lot of fellowships, so my residents run this hospital, and it's a large hospital, 350, 360 beds. And so there's a lot more autonomy in the subspecialties. There's also a very unique emphasis on the Loma Linda campus since its inception back in 1905. It was really built to train a medical student, and we've never really lost sight of that goal. So in the process of setting that goal, we have kept education at the core of everything we do. Do we do research? Yes, we do research. But education is very, very critical on this campus, and it is a huge healthcare education campus. So I'm looking for people who want to teach. I love residents that are excited about teaching, and that's a huge part of our program. We have a very diverse background. Our last class, we had 40% underrepresented minorities in medicine. Our graduates have done everything under the sun in all subspecialties. I've matched to competitive fellowships, including all the UC systems and multiple other large competitive programs all over the United States. My residents also come from all over the world. I have even multiple continents represented here on campus. For fun, they love the local mountains. We're within about 45 minutes of going snow skiing, going to the beach, or going to Disneyland. If you stay here at Loma Linda, we actually have a huge Drayson Center, which is a multi-sports complex. And that allows us to actually play intramural sports together. So we have teams called the PEDIATRICS, and we are kind of lightweights, but we play together and compete against various other residency programs on campus, medical students, pharmacy students, PT students, and have a good time doing that. I won't tell you about Blue Zones. I would highly recommend that you Google that, but basically it's a longevity center, and there are 5 of them in the world, and the city of Loma Linda happens to be one of the 5 in the world. So there's something about the lifestyle and the way that we do things here in this area that we'd love for you to come and be potentially interested in exploring. We're about whole person care, not just health, but wholeness. And we like to tout that for not just our patients, but also for our residents and faculty. We have huge global health interests with our GHI, Global Health Institute on campus, and have alumni at Malawi and Africa, and highly encourage our residents to go there or to other different out of the country places. We have a very unique ownership to our FQHC, which is our continuity clinic, but you cannot make an appointment with faculty there. It is totally owned by our residents. and community advocacy blocks and electives, as well as research electives, and 2 tracks, our categorical track, 100% at the Children's Hospital, and our primary care track, which is 50% at Riverside University, which is one of the county hospitals, and also 50% at the Children's Hospital. So we'd love for you to follow us on Instagram and join us for our open house October 1. And the information is right there at our Instagram account.
All right, thank you, Dr. Z. You actually finished with 10 seconds left. Good job.
Whoa.
All right, so we'll go ahead and advance to our next program. I believe it's Las Vegas. And your turn now.
Hey everyone, my name is Usman Yusuf. I'm actually in the same room as Program Director Dr. Cass. I'm one of the chief residents here in Las Vegas. I'm also supposed to be one of the recorders too, so just in case. Okay, so quick overview of UNLV. So obviously we're in Las Vegas. We're a medium-sized program. We have a good mix of academics and community. On the academic side, we work at 2 large children's hospitals here, Children's Hospital in Nevada, UMC, University Medical Center, and Sunrise Children's Hospital. Both have access to every subspecialty. We also have really strong focuses on our scholarly activity and community quality improvement. In terms of how we kind of balance the academic and community side of things, on the community side of things, we get to work one-on-one with UNLV faculty, with adjunct faculty, with all the subspecialists. We have everyone's number and we have direct contact. So it's resident talking directly to the subspecialist. So you get to learn one-on-one, hands-on learning, nice and experiential. We're also really intertwined with the community too. We have robust advocacy and community rotations where one of our doctors, who's also one of our APDs, has access and has connections with so many service organizations here. We're also very close-knit here. We have a great advisor mentorship program where you work one-on-one with an advisor and mentor. It doesn't have to even be what you want to go into, either Gen P's or fellowship.
You're wearing the
people who do fellowship all over, and they'll be paired with someone who is with Gen P. So it's a great relationship. Also, we have some great wellness things too. So we have resident families where people of all 3 years are combined together to go out, have fun in Las Vegas responsibly, and obviously socially distant at this point. We really have a great close-knit community here. We have great incentives for kind of doing well and being together. So we have resident of the block. We have a great wellness curriculum too. And we like to have, again, responsible fun here. There's amazing hiking here. There's like Red Rock, Mount Charleston. We're so close to so many national parks. We may or may not have residents who like to play poker with some of the attendings. We have wonderful food here. We're all up and down the strip. And then honestly, in the rest of the city too, there's wonderful places. So it's a great place. Las Vegas as a city doesn't really need to advertise itself. So you'll get a nice, fun experience, get to where you want to go, and get to live in Las Vegas. Our Twitter account's down there. It's also the same as our Instagram account, LVPs. So follow us. Let us know if you have any questions. That's it.
All right, thank you, Dr. Osman. Why don't we go ahead and go to the next program?
All right. Hey guys, I'm Alan Chin. I'm the program director at the UCLA MATTEL Children's Hospital pediatric program. I was literally in my car about 2 minutes ago, so probably not going to be as organized as the people that preceded me, but I would just say our program highlights. You know, UCLA, we're a moderately large program. We have about 84 to 87 categorical residents, 16 med-peds residents every year. That ranges because we also have combined programs like child neurology and medical genetics and pediatrics, and they have kind of varying kind of levels of time with us. Over time, you know, our residents being kind of a larger program in Los Angeles, we are a multi-site training program. We work at 4 main training sites that bring kind of a different strength, I think, to each one of the sites and kind of to your training if you choose to come to work with us. We have the kind of the MATTEL Children's Hospital is our main home base, and this is a large tertiary quaternary care center. within the Ronald Reagan Medical Center, sitting on top of the main UCLA campus. So I always like to say it's like as academic of a center as you could possibly make it. To counterbalance that a little bit, we have a number of kind of more general pediatric bread and butter sites. So we have, new this year, we made a partnership with Miller's Children's Hospital in Long Beach for our residents to see a good amount of general pediatrics in a number of different contexts there, both kind of on the wards, the newborn nursery, and the ER there. We also go to UNLV Medical Center. This is at LA County Safety Net Hospital, just a little bit to the north of Los Angeles. And it's a rural, underserved patient population, primarily Spanish speaking. We bring them into our safety net, and we actually then provide them not only specialty care, but also primary care. One of our resident continuity clinics is based there. And so we have an opportunity to kind of really catch these patients, usually coming in through urgent care or in the emergency room, and really set them up for well child care moving forward. And our last site is Santa Monica, UCLA. This is a community hospital owned by UCLA. Sits on top of our orthopedic specialty hospital. So we do sarcoma care there. We do, general pediatrics. This is actually one of our only hospitals where general pediatricians still admit to our hospital. So you get to work with general pediatricians out in the community. And this is just the 4 main hospital sites. We also have a number of different kind of ambulatory sites, including we work with the Venice Family Clinic, one of the largest free clinic systems in all the United States. So an opportunity to kind of really work in a lot of different pockets of unmet need in Los Angeles. And we're really proud. Our residents really get to choose what they want to do. We have very fortunate to kind of have very well-staffed divisions. We have almost every single fellowship program. They're fellows here. They love to teach. They have to kind of love to involve our residents. And I think that goes to show where our residents end up. Every year, anywhere from 40 to 50% going to general pediatrics, about 40 to 50% going to fellowships, and a number of different fellowships across kind of a number of different programs across the country. The only other thing that I really like to talk about is that, despite the fact that we are at different sites and different hospitals, we really consider ourselves a family. When we get to see each other, we're like little mini pods in each one of the different places that we go. And when we get a chance to get together, whether that is on our half-day didactics or other things, we're really excited to kind of see each other. And the last thing I would say is that we are a program that is not afraid of change. In fact, change is our business here. And so one of the things I like to highlight is, we've made changes to our where our residents go. As I said, Miller's Children's Hospital is one of our newest sites because it brings something really strong to our program. We changed our curriculum this year to a 4+1 schedule. So we have 4 weeks of kind of more clustered service rotations, always interspersed by a +1 week where you're doing your continuity clinics and outpatient specialty work, and actually have that weekend off. All this based around resident feedback as to what they want to do with our program. And so we're always trying to look to kind of how we can specialize it, individualize for you. And that includes kind of our different tracks. We have, a primary care and public health track. We have a global health and underserved track. We have physician scientist track.
Dr. Chen, interrupt you. Your time is up.
Yes, I did it. I filled it.
If you just want to quickly wrap up the last thing you're going to say, we'll move on.
Physician scientist track. That was actually literally the last words I was going to say. I was really glad I filled the time. Thank you.
Thank you, Dr. Chen. All right, we'll move on to Stanford.
Hi, everyone. My name is Carrie Rosbach, and I am the program director at Stanford. And we are extremely proud of our residency program and our incredible residents that we have here. Our vision of our residency program is to create outstanding clinicians and leaders in child health. And we do that through our 5 different programs. So our largest is our categorical program, where we have 27 new residents per year that we recruit. We also have a physician scientist track with 5 positions per year, a peds anesthesia track. We're one of only 5 in the country with this program, and that's 2 per year. Peds genetics also 2 per year, and child neurology is 4 per year. And we are very proud of our very diverse patient population, and we have a commitment to serving underserved communities. We have a lot of healthcare disparities and socioeconomic disparities in the Bay Area, and our residents are committed to helping address the needs of those vulnerable populations. We are also very proud that we have recruited a really nice, diverse resident group. And so we've got 30% of our residents are underrepresented. We continue to work on efforts to increase that even further so that we can represent the population that we are serving. Some of our programs that we are proud of include a scholarly concentrations program where all of our residents get the opportunity to participate in scholarship in one of 6 main areas. And that includes basic and translational research, clinical research, medical education research, community engagement and advocacy, quality improvement and performance improvement, and finally global health. We also have a coaching program that allows each resident to have a coach to help develop their clinical skills so that they can be the best clinicians that they can be. And lastly, over the last 4 years, we have developed a leadership education and advancing diversity program, which is an optional opportunity where residents and fellows can opt into gaining some additional training to become leaders in promoting diversity in our medical environments. We're very proud of all the fun activities that our residents get to participate in the Bay Area, and we are continuing to develop a few specific threads within our residency, including a new anti-racism thread, a mental health thread, and a number of other areas. And I'll end with our clinical sites. We've got 2 main hospital-based sites, which include our quaternary care children's hospital, the Lucille Packard Children's Hospital, which was, the new building was opened in 2017 and is state-of-the-art. And then we have our county hospital, which is Santa Clara Valley Medical Center. And the combination of these 2 sites provides our residents with a really nice foundation in both bread and butter pediatrics as well as more complex pediatric care. And then we've got 2 federally qualified healthcare centers that serve as our primary training sites for our continuity clinics, as well as a few other community partners. So, and I have here our Twitter feeds, and we also have an Instagram page, and we welcome you to learn more about us there. Thank you so much.
Thank you, Dr. Rosbach. All right, we'll go ahead and go to CHLA.
Good evening, everyone. My name is Michelle Thompson, and I'm the program director at Children's Hospital Los Angeles. I'm also a proud product of this program. I graduated in 1998. Hopefully, I'm not dating myself. So in terms of our program highlights, first, I would just want to emphasize our residents. They are the backbone of our program. They are the heart and soul. And we have a very diverse group of residents here. Our residents call 20 different states, including Alaska and Hawaii, and the District of Columbia, home, as well as 8 countries, and they speak 19 languages in addition to English. We are a nationally ranked children's hospital. We're in the top 5 in the nation, and we are also a safety net for underserved communities of children and families. We're also a quaternary high acuity, high volume referral center. So the combination of those 2 things in the same place means that our residents really have an opportunity to care for children who are being admitted for bread and butter pediatric issues, as well as kids with complex healthcare needs and subspecialty needs. Our continuity clinic site here at CHLA is also designated as a federally qualified health center, which again means that we practice in a very community-facing and focused way. You've already heard all of the wonderful things about Southern California. So Los Angeles, yes, we have the weather, food, entertainment, outdoor activities, and that runs the gambit from, I mean, you could go skiing, you could go hiking, you could be at the beach, all within several hours of each other. In terms of our curriculum, we are very proud of our longitudinal community health curriculum that is rolling out this year and is really incorporating throughout the 3 years of residency training behavioral and mental health, which is so important in pediatrics, child advocacy, and health equity. So in terms of our residents, there are 106 of them. 6 of our residents are on the child neurology track and the rest are categorical. Our residents, on average, 50% go into general pediatric practice, and the other 50% pursue subspecialty training and careers. And we have a community advocacy track, a global health track, an education track, and a quality improvement track. Our main training site is here at CHLA. We do have some newborn experience at Kaiser Sunset, our partner across the street, and across the street in the other direction. Our community hospital partner is Hollywood Presbyterian Medical Center, where our residents do a little bit of NICU and then also some newborn nursery. So happy to take any questions later, and I'm so excited so many people are interested in doing pediatrics.
Thank you, Dr. Thompson. All right, and last but not least, we have Tucson.
And I think for Tucson, they didn't get that infographic in, but we have a spot held for them.
Okay, we did. I'm kind of sad. It's pretty, but
You have
I will just.
If you have it on your screen, you could share.
No, I don't. Unfortunately.
Yeah, it didn't come up in time to get into the total presentation.
Okay. Well, so I will just introduce us. Tucson Medical Center is a new program. We started our first class in July of 2019, and we now have our second class, a total of 8 residents. So the next class will put us at 12. We are a community hospital with 33 pediatric beds, 12-bed PICU, and a 42-bed NICU. And we turn over about 30,000 patients a year in our pediatric emergency department. So we are very busy for our not so small community hospital. We really tried to minimize your inpatient time and call, but also allowing for 6 months where you can do more inpatient and call if you want to. And we really are maximizing rotations out in the community and with subspecialists so that our residents can kind of get more time seeing a variety of things. We've partnered with El Rio Community Health Center, which is a massive federal health organization in Tucson, and we do all our continuity clinics there. And we, sorry, there's a fly out here. And we also do rotations there, which is really nice because it allows you to really get into the community of Tucson and get involved in public health and advocacy within Tucson. So we are small, but spread. Again, we have our fingers throughout all different kinds of places and practices in Tucson. And we don't do kind of tracks or anything like that. We really like to be able to specialize our curriculum to the individual residents. And that's the advantage of having so few, is that you can really focus on each one individually. So that's us.
All right, thank you, Dr. Eck. And I think on the updated slides, I did see Tucson's information, so maybe we can share that. I wonder, Dr. Reason, if I'm able to take over sharing and just quickly go to Tucson. Just so that the students can maybe just screen grab this and at least you have the contact information.
Yeah.
Okay. I'll give you guys a couple of seconds to grab that. And then afterwards, we'll move on to our Q&A.
Thank you for going after that, Kelly. I updated this about 2 hours ago and it wasn't there on my laptop. Sorry.
No problem. That's what we're here for.
That's right. That's what chiefs are there for. Their job is everything.
All right. I am going to turn it back over to Dr. Reason, the screen share, in the next 10 seconds, and then we'll get started with our Q&A. So students, if you have more questions, go ahead and put them in the chat or put them on Twitter, and our moderators will grab those for us. All right. So, Dr. Reason, if you want to take back over screen sharing, thank you. And we'll go ahead and get started with our Q&A portion. So looks like the first question we have, if Derek or Marianne would like to tell us who sent the question and read the question aloud, and then we'll have our respective program answer it. And then if there's any program specific questions, we'll make sure that program gets the answer. If it's a more general question, we'll try to get multiple programs to chime in.
Hi, I'm Marianne. I'm one of the Loma Linda primary care track residents. So I'll go ahead and read the first question. It's actually directed for you, Dr. Reason. So it says, for Loma Linda, what would be the draws for someone to pick categorical versus primary care track?
Would you like to answer that, Mary?
Yeah, I have no problem answering that. So
go ahead and answer that since you're in the PCT.
Sure. So the thing that makes primary care track special is that, you know, we're kind of a small family within a bigger family. We're 4 residents per class, so a total of 12 residents. We work really closely with, you know, Dr. Reason, but also Dr. Versio, who's the primary care track program director. I found it really amazing to be able to work at both a community hospital, county hospital, Riverside University, as well as Loma Linda, because you get both the academic university feel with all of the subspecialists and all of the, you know, complex medical care, but also you get the community hospital feel, which I think really adds value to our education, especially for somebody that, you know, wants to have that experience and have a perspective of what it might be working in a community hospital, what it's when a patient needs to be transferred to a larger medical center and things like that. I feel really close to my primary care track residents and I've really enjoyed getting to know them, but also, you know, really feel completely part of the Loma Linda categorical family as well. So.
All right, thank you, Marianne, for that wonderful answer. So I think we'll go ahead and go to the next question, which it's for any program. So I'll just go ahead and read the question just because I'm not sure who had put this on the list, but this one is from Michael Bagg. It says, I've seen that chair letters are considered optional at some programs. Does that mean they are recommended? If there is a program that would like to answer this, you can go ahead and unmute yourselves.
How about if we just shine, Michelle, I see your face is up there. Would you be willing to take that, Dr. Thompson, Michelle Thompson? The dean's letters?
Is it the dean's letter or the like a pediatric program chair letter?
Oh, yeah, the chair letter, yeah.
Okay, so a letter of rec, basically.
Yeah, I saw some programs like will list it as like you don't have to send them, but they don't really. It's I'm not sure if that means like it's still recommended to send one if you have it, or what? How we should approach that.
Yeah, I mean, I think if a program says it's optional, like for us, I can speak for my own program. We do not require a chair's letter, and hopefully there's no chairs on the call. But sometimes, honestly, I would much rather have a letter from someone that you worked closely with. Even actually, if that person is not a pediatrician, who can really speak from a place of direct observation. If it's longitudinal, that's even better. So that's what I would say. Sometimes I find that the chair's letters are, sort of really a rehash of things that I can already pull out of your application as a whole. And so to me, having that personal experience with someone is more meaningful.
I would certainly second that. I would much rather have a real letter of somebody who knows you well than a chair's letter. Chair's letter.
I was just answering the same thing on the Twitter, actually, was that it doesn't matter what rotation they're from, as long as it's somebody who knows you well, who's your advocate, right? I think the chairs, it's hard for them. They have to have a very standardized letter. It's hard for them to kind of really, be your advocate like somebody else might be. And I think that's going to be the thing. So if they're really optional, I think that means you should find somebody that best fits you. Find a letter writer who's going to speak to you about you in such a way that's really going to support your application. I think that's the most important thing.
All right, thank you everyone for answering that question. All right, so our next question comes from Kylie Seeley. Our programs plan to utilize secondary applications this year, and this is open to any program to answer.
Well, Melinda is not.
I was going to say, I'm probably too honest here, but I don't think I have time to review a secondary application. Like I don't, you know, so no, I'm not going to require it.
We aren't either at Stanford.
Any programs that are? All right, I don't hear anything. So sounds like most programs, at least in this room, are not doing secondaries. I'll go ahead and go to the next question. Dr. Chen, would you like to read it aloud?
So this actually is a question for Dr. Chen. Hi, I'm Derek. This is from Yvonne Lee. I loved your answer. You already answered it on Twitter, but I thought it would be wonderful for you to answer it here as well. It said many residents say the best way to find out whether a program is for you is by getting to know the people there to see if you're a good fit. With the current limitations, what suggestions do you have for getting to know the residents and faculty on a deeper level?
You know, one of the things I said was, you know, just get involved with many of these things that you feel comfortable with, including webinars like this. But most programs are offering some opportunity to talk to either faculty or residents or a combination of both, having open houses. I think you want to participate in those, get a sense of a program from there. And then, I say this every year, even when we're in person, trust your gut, trust your instinct, you know, even though interviews are going to be a little bit different with a Zoom, you know, trust your impressions. You know, you have an instinct, you know how you feel about a place and the people that you're talking to. And so you trust that. You know, so often we're like looking at data and Excel sheets and like, you know, all the notes that we take. This is the one time where I really say, you know, trust that instinct, trust your gut. You'll know it, and just take the opportunities where you can to kind of meet with people. Even if it's asynchronous, even if it's email, even if it's some other way to kind of communicate, you'll get to know programs and people.
All right, thank you, Dr. Chen. There's actually another question from Taryn regarding UCLA and CHLA programs. Are we able to initially apply to a particular track, or is that something we decide after starting residency?
I'll just quickly start since I'm on a little bit of a roll. There's only one track that we ask for kind of applications for at the time of kind of the ERAS opening, and that is for our physician scientist track. It takes us a little bit longer to kind of set up those days and make sure that those are set. Otherwise, we actually don't ask residents to select into a track until about halfway through their intern year, because that's when we start building their block schedule for the next year. That's where most of our curriculum starts.
Dr. Thompson.
Oh, yeah, thanks. For CHLA, likewise, we will sort of have informational sessions about the tracks again during the orientation phase. And then we like to give people a little time to get their sea legs and just see what internship feels like before, you know, deciding if they want to make that commitment. So typically all of our residents sign up for the tracks after they've already matched and started here. And it's usually somewhere within the first, like maybe by month 3, I would say, block 3 to 4.
I would like to just say that you need to be really careful for all the applicants that are out there, that if there are separate tracks, for instance, like a primary care track, you are actually applying to 2 different numbers. So be really cautious about that. So something like, generally it's a primary care track. You have to apply to that. You might apply to the categorical and a primary, even in the same program, and rank them slightly differently. So those are actually very different than what Dr. Chen and Dr. Thompson were just talking about.
Thank you, Dr. Easton, for clarifying that. All right, and then I think next we have Derek. Do you mind reading the question number 6?
Sure. This is from Camille Fonseca on Twitter. Her question was, how do West Coast programs support and advocate for their underrepresented minority residents?
I think any program can answer this.
Yeah, that was for any program. I'm sorry.
I'm happy to take a stab at that one. I think a lot of our West Coast programs are doing similar things, but we're all working on different ways of mentoring our residents. I mean, I think we all are committed to being programs that include and make sure that our residents feel that they have a sense of belonging within our programs. I think we are all committed to being anti-racist and If I tell my residents that if you ever experience an event that is discriminatory, please reach out to us, because we want to make that better and we want to try and address that, and we need that information so that we can do that. We also provide some additional mentorship opportunities for our underrepresented residents, and we nominate our residents for a couple of national mentoring opportunities, including the Academic Pediatric Association's New Century Scholars Program, and the APPD now has the AIMS program, which is Advancing Inclusiveness in Medicine program. And those are both great programs that provide mentorship and help people develop their careers in pediatrics. And that's pretty unique to pediatrics. Not all specialties offer such things like that.
All right, thank you so much for that answer. Derek, I think you also have the next question. Do you mind reading that one aloud as well?
Sure. This is kind of a two-faceted question. It was a question from Hannah Grierson and Madeline. It was a similar question, so I clumped them together. So Hannah said, as someone who's from the West Coast but went to medical school outside the region, does that put me at a disadvantage? How heavily does regional bias factor into interview selection? And then Madeline's question was, similarly, if you are from and went to a school outside of the region, is it difficult to break into? How do you show dedication to wanting to move and practice in our region?
This one is also open to any program.
I was just about to say, I don't know if I'm just too trustworthy. I just believe what people tell me. And they're like, I would love to come to Los Angeles or be at your program. I'm like, great. I'll, come on by. We'll talk. We'll see if we're a good fit. And so I try not to think about kind of where people are coming from or what school they're at, or even necessarily that they have necessarily been to California before. I think everybody finds a home and place that fits. And I think everybody just kind of has to find that place that's going to be a good place to do their 3 or 4 years of training.
May I nominate one of my chiefs to give her answer also, because Sam Scanlon is one of our chiefs who came from outside of California. Sam?
I apologize. I was answering a question on Twitter. Do you mind repeating the question?
How does it feel, or how was it accessing a West Coast residency program being a medical student from outside of the West Coast?
That is a fantastic question and very similar to the one I was just answering. So I came from Arkansas. I spent almost my entire life in the Southeast, and I decided I wanted to branch out for residency. So I felt the similar pressure of feeling like it was hard to break out of that bubble, especially in a place like Arkansas, which is fairly unknown to areas outside of the Southeast. But I tried not to let that stop me, and I interviewed pretty broadly. And I felt like people were very receptive as long as I explained my reasoning and willingness to leave the area. And so I think just being really upfront, if you do have interests that would pull you out of kind of the typical pattern. And I think the West Coast, I felt very welcomed. And so it wasn't something where I ever felt like it was going to preclude me from being able to interview or even match in these locations. So I think on your interview day, just be really upfront and mention if there is a particular reason you want to be in the area. I have to speak for Stanford and say it's always been fantastic that we have people from all over the country and all over the world, and that's something that's a priority, and it was important to me. And so I never felt like that was going to be something that would stop me if I did want to come out to the West Coast.
I wanted to kind of answer that as well. I kind of want to actually bounce off of what she just said. I'm from Georgia, been there my entire life, and when I interviewed out here, everyone was super cool about it. I think people enjoy having people from other places, because then if you just have a bunch of people from California, they might not be able to point out Georgia on a map. So I think having all people from all over has been really fun. And honestly, has been one of the best part of my experience here. Everyone who wasn't from here got to kind of experience the city and residency together on their own. That's what really helped make our program so close-knit and got me my friends here.
All right, thank you, Sam and Osmond. Those were great answers. I am also from Tennessee, so I guess the Southeast is really represented right now. All right, we'll go to the next question because we got a lot of questions to answer here. And I think we have, they're gonna keep the room open for about 15 more minutes. So The next question is from Nikhil Kumar, asking about which programs in this panel give us the opportunity to teach and have medical students, both MS3 and MS4 on boards. Any program can answer.
I will definitely answer that one because that is what I'm looking for. I specifically interview and screen for those that I know have had education, been previous supplemental instructors or teacher's assistants and done various different things with teaching, because we have a lot. I mean, my residents will tell you that they have a medical student at side at all times, as well as some other healthcare learners. I think any program that's affiliated with a university, you're going to find that they have medical students. So finding that program that you feel is really truly that educational environment, it's going to frequently be affiliated with a university.
Yeah, and just to, mention at Tucson Medical Center, we have med students as well and look for people who want to teach them. I think that the demand for rotations is high, and I think it's becoming more and more rare for you to look at a program that doesn't have medical students rotating on their wards with you.
All right, thank you, Dr. Reason and Dr. Rosbach for answering that one. The next question is geared more towards CHLA and UCLA. How many residents faced challenges with commuting and traffic?
Hey, I'm not going to sugarcoat it. There's traffic. This is Los Angeles. It is a thing. So it is one of those things that we actually design our rotation schedules in and around traffic. And in fact, our shift changes are around traffic. So if you're going to Santa Monica for a rotation, that shift changes 6 to 6, while our main hospital is 5, right? Because you can get there faster. When you go to, all of you, for example, that's actually at 9 p.m. So every single one of them is designed around the traffic patterns. And in Los Angeles, they're unidirectional. So usually there's one way that's totally clear, and that's what we're targeting. We're targeting you the totally clear path to and from work. But I think part of the times when we fight traffic the most is times where we are trying to have fun. And so going out and about, that's probably the most challenging thing. I would say that one of our APDs, Cambria Grill, always tells a story that she managed to get through our residency program riding the bus and biking everywhere that she went, including all of you. And I'm incredibly impressed by that. But most of us have a car. And so most of us have some way to kind of really manage with the traffic. But it is within our thoughts. It is one of the first things we deal with whenever we talk about a new rotation or a new thing we want to add to our curriculum.
NT, I can speak for CHLA. I'm a second year resident at CHLA. We have housing across the street from campus, so a lot of our residents live there, and so that we don't have to fight traffic for that. They just cross the street and come to work, which is really wonderful. I have a dog, and so I don't live in the Rodney, and I still live very close to CHLA and the 2 other sites that Dr. Thompson mentioned that we rotate at. It's nice having sort of all 3 of our clinical sites in the same area. So I live about 5 minutes away driving. I could bike to work, but I don't often have to deal with traffic, which is a nice thing. I would echo what Dr. Chin said. If we want to do a fun thing and like get out to the beach or get out somewhere else, then you're fighting LA traffic. And we have residents who also have partners in other programs in various parts of LA. And so they live more spread out in the city. But even they, I think, when they do have to fight traffic, like Dr. Chin said, we have one resident who says it's a great time for her to call her parents because she's from Texas. So they deal with it.
Thank you, Alexa. So our next question comes from Madeline Wheeler. This is again for any program. Our program is going to incorporate ways for interviewers to be able to talk with residents virtually in a low pressure environment.
I'm just going to put a plug out there. If you see our website, there's a place to sign up to meet with me in a low-key time frame. I'm just setting up 30-minute meetings with people who are interested in our program. So far, it hasn't gone out too far. I haven't been overwhelmed, so happy to kind of meet with anybody else. For our interview day, we are actually planning like a coffee talk with a resident, because one of the things we know is that the best part of our residency program is our residents. And so I want you to have an opportunity to meet with them. And so we're calling it Coffee Talk. I don't even want to call it an interview because I want it to be informal. I wanted you to have an opportunity to really kind of talk with people who are in our program now.
We are planning to do our typical happy hour. It'll just be over Zoom with our residents. They, as usual, are looking forward to drinking wine on the residency program dime. And so, you know, we'll have small groups with a couple residents. You guys can have a glass of wine over Zoom, unfortunately, instead of in person, and be really low-key way to get to know them.
I will say for Loma Linda, we are planning to have very casual resident hangouts outside of the interview day via Zoom and also via Instagram. So look on our website and our Instagram page for updates about when those will occur.
We also are going to have some informal mixers for our program. I imagine all of our programs will do some sort of, we're all trying to make sure that you as applicants get a chance to meet our residents and of course think creatively about how to do that and get people engaged and such, but that is a priority for us for sure. Sorry, Michelle.
I was just going to say exactly what you said. So thanks, Carrie.
Yeah, this is the same with UNLV. We're definitely going to have the night before we open for our interviews. We will be having a session that you guys can participate in with the residents and have opportunity to communicate with them. Very low key, kind of chill, and have the opportunity to get to know them a little bit. So you kind of know what you'd be coming into because we definitely set up our program as very, very family oriented and very close knit because we're not that big. So just keeping that into perspective for you guys.
All right, thank you, everyone. So the next question comes from Bethel Miso. Are any programs other than UCLA anticipating moving towards an X+Y schedule?
I'm going to speak for Stanford, unless you want to talk, Carrie. We're talking at the same time.
Go right ahead, Sam.
So that's something that at Stanford we are actively exploring. It's not something we have instituted this year, but we have been talking with many of the children's hospitals around the country to think about how we might implement it here at Stanford, because it's definitely something that has been brought up multiple times over the last few years as a potential way to help relieve the burden of having to sign out while you're on a busy rotation and also being able to prioritize your primary care experience. So it's something we're actively exploring and hopefully we'll be able to implement.
I think I
Melinda
saw.
doesn't have any current plans.
No. And I think I saw Dr. X shaking her head as well. Correct me if I'm wrong.
Loma Linda does have large block months where my residents actually run that clinic. They're there, they're basically the clinic managers. So that it's a slightly different curriculum.
All right, thank you. Next question is from Michael Bagg. What did your programs do for residents during the beginning of the pandemic?
So we had the luck of being a small program, and we don't do NICU till second year. So when the pandemic hit and we lost some of our subspecialty rotations because they just kind of shut down, we just shuffled our residents over to the NICU, and they didn't really miss out on any educational opportunities. Advantage of being small is you're only, well, for me, I was only dealing with 4 people.
We actually did several different things. I forget what they call it. Platooning, I think is what the ACGME calls it, where we took some of the residents that were on wards and sent them home. And they actually followed rounds from home so that they could hear what was going on with the team. Then we would rotate them in and out so that we had less residents on the wards when we had fewer patients. And then we did several other things with our outpatient clinic, and we got outpatient, or what's it called, video and telephone visits up almost immediately. So my residents have gotten very, very good at telephone and video visits, and we're still doing a lot of that.
Yes, similarly at CHLA, our residents were doing a lot of telehealth visits in the ambulatory setting, also for their continuity clinic patients, which is great. And we were doing a lot of outreach with our patients and families, and understanding that not having access to coming in to see their doctors, just having a check-in, almost like a check-in connect that our residents would do with their patients, and the faculty the same. For some of the programs or for some of the experiences, we put together sort of distance learning, reading electives, those kinds of things. And so I think people just were learning how to learn in a different way. But
thank you, Dr. Thompson. All right, so the next question, I think what students want to hear is maybe perspective from some residents on this. Could you touch on some moments and experiences that made you proud to be affiliated with your institution?
I'd be happy to speak on that. So hi, again, I'm Marianne. I'm from Loma Linda. So one of the things that recently happened in my life was my mom passing away, which was a kind of just unexpected thing that happened. And one of the things that impressed me most and made me really reaffirmed that I chose the right program was just the immense support, accommodation, you know, understanding that I received from everyone. And despite it being such a large program, the outpouring of support and, you know, willingness to, you know, get coverage for me, just switching up my schedule was immense, because at the end of the day, we're all people, we're all having different things come up in our lives that are unexpected. And so that humanness aspect, that no, I'm not just a resident here to work or whatever, I'm a person that they really care about, and just like different attendings reaching out to me, different residents, and people stepping up to, you know, cover for me during that time, really the hardest time in my life, was incredible. And yeah, so.
I definitely want to co-sign with Marianne. My name is Derek. I'm one of the pediatric residents at Loma Linda as well. At the same time Marianne was going through her hard time, I actually ended up having a child who was in the NICU. So that was kind of a different experience, being a pediatrician who works and having a child in the NICU. And I felt the same thing happening with my, you know, just the interaction with my resident classmates and friends, and the faculty support, giving me time to spend time with my child, just being able to kind of check in throughout the day. You know, checking in with me and my family and my wife, just making sure that we were okay, bringing food by, helping me with furniture that I wasn't able to pack, you know, things like that, or didn't know how to assemble. It's the small things.
One thing at UNLV that I thought was really cool, my intern year, so I'm chief now, so intern year was when the October 1st shootings happened here. And again, we're all pediatricians, not really experienced in any trauma, but all the residents that were on at night, especially at the hospitals that got hit hardest, they were in the ED helping out. One of my best friends who was an intern that year ended up doing ED kind of based on that experience. So it was kind of cool to see residents step up and kind of like, I'm willing to do whatever we need to do in that situation. And kind of as a city as a whole, it just really brought everyone together. Yeah.
Thank you everyone for answering.
Sorry.
Oh, is there someone else you wanted to add on?
Yeah, sorry. My name is Maz. I'm a resident at CHLA. I think, I mean, all of these stories are just kind of reflections of like people being really proud of their program and their co-residents. And I think mine is a little bit more of a general thing. In the times of COVID, I think all of us have just really had to adapt. And so I think that overall, I'm just really proud of the way that our program handled all these changes from the administration down to the residents, whether it means like restructuring our curriculum so that we can try and still have educational opportunities, or residents like really stepping up when it comes to like a COVID exposure and people having to quarantine appropriately. I just am really proud of the way that our program is kind of banded together. And we really kind of support each other both inside and outside the hospital. COVID is a really tough time on the medical system as a whole, but also I think on our mental health. And so like, it's been really great to see how our residents have kind of banded together to try and still do like wellness related things for each other to try and be mindful of our mental health during these crazy times.
Sorry, I know we're running out of time. Just to piggyback off of what Matt said, again, I'm Alexa, I'm from CHLA. I think one other thing that has come to light with COVID is that many communities are disproportionately affected, and at CHLA we serve a large community of color, and many of our clinic patients at our clinic are families who have been really affected. And so one of the things that made me feel really proud is some of our colleagues set up a drive for basically like grocery store gift cards, and as a hospital we just from the ground up raised a ton of money to have Vaughn's gift cards to hand out to all of our families who have been really affected. And it was really, you know, I think the whole project was really special, but then actually getting to be in clinic and have a family, you know, screen positive for food insecurity and tell us about the hard time that they're having, and then be able to provide them that and know that it came from our faculty, our residents, like the people at this program. It was a really wonderful and proud moment.
Hi, Makela here. Sorry, I just wanted to let you guys know there's about 5 minutes remaining, and then everyone will come back into the main room, and that's going to be the end of it. But for any faculty, residents, participants who helped us today, if you want to stay on for a little bit just to do a quick debrief, feel free to do so. If not, also you're welcome to leave as well, but continue.
All right, thank you, everyone. Before we go to the next question, Dr. Rizin, do you mind advancing this slide just so that students have that QR code? I believe it links to the upcoming webinars. Thank you very much. All right, and so we're going to try to answer as many of these as we can. So next question, how are programs supporting the integrated research pathway for applicants not being able to get into a specific physician scientist track, but still interested in research and want to have clinical training in your program?
I'll be on. Oh, go ahead.
I was just going to say that we have a physician scientist track with 4 positions a year, and we do have residents that go on the integrated research path on that pathway, but I actually haven't had any of our categorical residents request the integrated research pathway. We would have to map it out and see if that was possible to give them extra research time. But I think with the individualized curriculum that the ACGME has for 6 months for each resident, that does allow all residents to do a fair bit of research if they desire to do that. So.
I was just about to say, for our categorical residents, I don't ever get to the integrated research level. I don't get to the 9 months, but we can get 3 or 4 months in the individualized pathway. If that's something they're really interested in and you're on track with your clinical work, we're happy to entertain that.
All right, thank you. This next question comes from Adriana Worster. For upcoming residents interested in multiple areas, such as advocacy, education, and research, are there opportunities within your program to touch on multiple areas outside of your chosen track?
I think pediatric residents in general often dabble in more than one area, and that's one of the strengths. I think pediatricians recognize the need to advocate for children in many different domains, and so that is fabulous as long as you can keep up with multiple initiatives or projects. Some programs, we have a scholarly concentrations program as an example, where residents get to choose one of 6 areas of concentration, and advocacy is one of them. Research is another one, education is another one. And we do ask residents to choose one as their primary area of focus so that they can commit to a project. But some residents will participate in more than one project during their time. And my sense is at other institutions that is also true.
Thank you. All right, we have about less than 2 minutes left, so we'll try to answer one more. Taryn Jurgensen said, for expressing your interest and reasons for being in a particular state, did you mention it in your personal statement?
You don't have to, but you can tell me in some other way on the day in an email. I'm happy to keep track of it.
Yeah, I agree. I think it's really helpful if you have some very specific reason for being in a specific city or a specific program to let that program director know. I personally would want to know that your husband lives next door, you know, in the city next door, or that, you know, your fiance is matched to Loma Linda. Sometimes that will get lost in the shuffle. So those are the kind of things I'd want to know.
All right, I think we're almost out of time. Sorry we didn't get to everyone's questions, but just want to wish you all good luck out there, and feel free to contact these programs with the information that was in the slides previously.
Thank you, everybody. Great session.
Thank you.